Hi folks, it's Reddy, your holistic dentist. The topic for today is dentistry and vibrational medicine. It is something that's not commonly spoken about, but is very relevant. And what made me delve into this, right? For the last 20 years plus, I've been exploring this and studying it and delving into literature and going to historically what they call is the Bach remedies, and in Germany what you call the science of homeotoxicology and homeopathic treatment, and there's Chinese medicine, the South American medicine, those of other avenues of expression. Now there's two parts of healing that we know about. One is a normal traditional healing, the physical healing as administered, what they call is pharmacokinetics, right, whereby we see a patient and we look at it mechanically and we dispense drugs and we intervene surgically. But there's another aspect of medicine. It's called astral medicine, astral healing, which we know as sometimes people refer to as Einsteinetics, right, in terms of relation to physics and relation to chemistry. We all know as dental medical graduates and students that we study biochemistry and we study biophysics in the first year, but unfortunately we put in file 13 as we progress in our studies and as we practice, right? Now, during this COVID time, and I was involved with the South African Dental Association as being the member of the association for many years, and I participated in terms of seminars and helping colleagues to understand what space you are in relation to healing, how you handle COVID yourself, how you handle your workspace, how you handle your patients. Now, not everybody was in tune to say that, can I live alone? Can I be isolated like the pandemic has shown us? Can you have a total shutdown, right? But the shutdown is merely a physical thing. But naturally is that people were so-called in a secluded place, could not mix, could not traditional restaurants, could not go to dinners or go to functions, but you have to be, everything need to be online. So this kind of online effect of people's engineered in this COVID situation that altered the personalities in some way. So what is the evidence that we found in people during this time? Now, to understand that, if you're in a positive trajectory, we know the science tells us that in your cell function, in your electronic structure, you have 18 electrons in your K, L, M, N shells. So that necessarily keeps you integrating your personality in terms of your positive trajectory. But when you're not so positive, right, and you're perhaps technically a little bit depressed or out of sync in your balance wise, that these electronic shells and the electrons in these shells will jump out of the shells. So when it does that, it causes an imbalance in your personality, what you call emotional dysfunction. And sometimes it presents as depression, presents as mental kind of challenges in patients, and in terms of your also physical health. So what happens that when you have a biophysics dysfunction? We know that the biophysics dysfunction at a cell level, what we call the mitochondria, which is a powerhouse of your existence, of your function in your whole body system, that in turn affects what you call your biochemistry levels, what you call you have a protons and neutrons in your cell function, that in terms is altered. And then it manifests what you call as so-called not so healthy state, and maybe call it as a disease state. That is the one aspect of disease. Can be whether it's a lung infection, whether it's any other infections in your whole 7 systems of the body, it may affect even in cardiovascular systems. Now we know for a fact that in your heart rate you have a sodium and you have a potassium pump. It tend to be in sync like that. Now we know that in these two elements, if they're not in balance, it affects your heart rate into what you call is your valves. Take one of the valves is your mitral valve and your aortic valve, and the frequency changes like that. We know that we have a neuron and a dendron that vibrates at a certain frequency there when you're totally in balance and sync. But when you're not in balance and sync, when your biophysics structure is altered, the biochemistry altered, the vibration is altered like that. Hence it presents as headaches and present as neurological symptoms, affects your parasympathetic systems. You have neck pain, shoulder pains, and you tend to have muscular pains. right? And so you need to understand that the subtle effects of how it affects you, but it presents as a gross effect afterwards if it's not adhered to in a positive trajectory. We know that in the early days that there's two aspects of the subtle part of healing. One is called PNI, and the other one is called NLP. Let's talk about PNI first. PNI is your psychoneuroimmunology. It's your psychic state, your neurological system, and your immune system. We know that if a psychic is in a positive trajectory, it affects your neurological system in terms of vibration, what I spoke about, your nerve ending vibrate correctly in certain frequency. If that happens, that your immunity is affected positively, what you call the antigen antibodies and your lymph drainage. That's a wonderful thing that happens there in your psychic. So it's important to understand that you have to see the world in a positive light. In the darkest of skies, I always tell my colleagues and my patients, there's a shining star and there's a light that's present there, and that's tuning to the positive energy. Let's talk a little about NLP. NLP is what we know as the philosophy of NeuroLinguistic Programming. Not just a philosophy, but it's a practical entity of life. How do you articulate, how do you dispense information in the positive sense to the patients, to your colleagues, to know that if I'm in a positive sense to see the world positively, the world responds positively to me, right? And it's about cause and effect. So it's called the principle of resonance. It's imbued in the 3 R's, what we know. First of all is that everything that in life, to have a positive effect in life, you need to reflect before acting. So if you reflect in your life and you create a certain positive resonance, and then you react correctly, right? When you react correctly, that you're in sync. We know that with your biochemistry and with your biophysics. And you find that your parasympathetic effects is affected in sync, what you call in Chinese medicine as a yin-yang balance, your left and your right, right? So important to understand that your whole pattern, especially why is it important from a dentistry and oral health perspective, this part of your body is the intricate part of the nerve and what you call as the head and neck section. All dentists will understand that, and the people involved in general medical science, this is the most intricate part of your body. The nerve endings are dense, the arteries are dense, the veins are very dense in the area, lymphatic drainage is there. So it's a critical part of the body to understand that this part of the body, and where I say to my colleague dentists, we are oral physicians and we're just not dentists looking at mechanical perspectives, right? When you look at oral health, we're able to see iron deficiencies in the mouth, we're able to see early cholesterol in the mouth and airway blockages, which can arrested early can prevent ear, nose and throat surgical interventions, and further it can arrest what you call lung infections. And we know during COVID crisis, lung infections are the most critical factor in terms of sustenance. Right? Just to summarize, vibrational medicine, whether it's to the Bach theory of the Bach essence of flowers, what's now in modern day science call it the science of aromatherapy, and what we know as acupressure and acupoints of interventions in terms of needling, and what is modern day contemporary talks about reflexology, and we know people talk about Reiki, it's about transference of energy, but the power lies within you. And what the science is it? If you get a fracture of your hand, whether you are age of 5 years old, 50, 25, 50, you heal within yourself. Right? And we know the science tells us that 6,000 square miles of blood passes through every second. So the power lies in you to alter yourself, to create the vibration yourself. Right? So we will definitely extrapolate this as we go in further videos to show how vibrational medicine from an oral perspective or health perspective affects your general health perspective. And I dare each and every one of you to press the like button, to subscribe, and to get the follow-up videos for us in the next few weeks. Thank you and have a great day.